Thank you for joining us for this Advent Health virtual seminar. We hope you'll find the material presented helpful and informative.
Good morning. I am Dr. Amir Ahmadian, board-certified neurosurgeon. Today, we'll be talking about minimally invasive spine surgery, what you need to know. To understand minimally invasive spine surgery, you really need to understand the origins of back and neck pain, and then further understand the anatomy of what causes pain, called the pain generator. Once you have the basis or the foundation of anatomy of pain, then we will be talking about what minimally invasive spine surgery truly is. Neck and back pain is very prevalent. In fact, up to 90% of people can have pain at some point during their life. The lifetime prevalence of this pain is between 60 and 90%. There is an annual incidence of 5% in the community of back pain. However, up to 85% of back pain, at least the causes of back pain, is very unclear. Furthermore, up to 90% of acute lumbar low back pain improves with minimal or no medical treatment in the first 6 to 8 weeks. Now, there are different types of back pain. There's acute back pain, there's chronic back pain. Acute back pain is muscle strain, an acute disc herniation, a trauma such as a slip or fall, or a small fracture in your spine. Acute back pain can also represent sacroiliac joint strain or an infection or inflammation. Chronic back pain is degenerative. These are findings such as arthritis of the spine. This happens over a long period of time, and sacroiliac dysfunction can represent degeneration of the SI joint. Another type of chronic back pain or low back pain is related to infection, but particularly due to inflammation. This inflammation can happen with systemic inflammatory diseases. Now, the anatomy of pain. It's important to understand anatomy to determine what is causing the pain. This is a picture of the lumbar spine, which is the lower part of your back. Here you see a radiographic image, which is an MRI, that shows the disc spaces between the vertebral bodies and the joints that make up the entire spine. Now, the lumbar vertebrae, as you see here, it provides support for your whole body, your head, your torso. The disc spaces between the vertebral bodies are like shock absorbers around the spinal nerves. On the right, it shows what happens as we get older. This means that the disc starts to degenerate and dehydrate and push towards the nerves. This causes spinal stenosis, which is tightening or pressure on the nerves, which then represents a lumbar radiculopathy or nerve pain that extends outside of your back. Many people call this sciatica. Now, the types of pain that you get from the disc and these joints are called axial back pain. Axial back pain is discogenic pain, meaning pain coming from the disc, or facetogenic pain, pain coming from the joints around the spine. Radicular pain is related to impingement of the nerve, that stenosis we talked about. And furthermore, musculoskeletal pain, yet another type of pain, comes from the attachment of the muscle to the bone, and this happens from either a muscle spasm, poor posture, or muscle fatigue. Now that we understand the basic anatomy and origins of pain, what is minimally invasive surgery, particularly spine surgery? MIS surgery really emerged in the 1980s as a safer, more effective technique. Over the last 4 decades, it has been a source of great innovation in the field of surgery, particularly spine surgery. MIS surgery is not just a technique, but rather a surgical philosophy. This philosophy is to minimize the surgical footprint, minimize the disruption or damage to the tissues, to develop a surgical corridor so you can decrease bleeding, and achieve the surgical objective more efficiently than previously done. Now, these advances in the last 4 decades for spine surgery have been many. One is advances in lateral spine surgery. That's doing surgery of the spine from the side. At this point, it has been adopted widely by many minimally invasive spine surgeons. It allows you to gain access to the spine by not disrupting the muscles of the back. This allows for faster recovery and better correction of the pathology. So what is MIS? MIS is a technique that allows for less injury to the body, a safer surgical experience, a much faster recovery, less pain, and less scarring. It also allows for your hospitalization to be shorter. There's a much better cosmetic outcome as well, as the incisions tend to be smaller. There's significantly less blood loss, and the risk of infection is much, much less. Now, how do we do MIS surgery or minimally invasive surgery? Here you see some of the basic tools of minimally invasive surgery. This includes working ports or tubes where we get access to the spine without cutting any muscle. On the middle, you see the picture of a microscope. This is a surgical microscope that we use routinely to gain access to the bones and the nerves without disrupting any other tissue. And furthermore, these techniques and tools can be used to do bigger and bigger surgeries, especially for patients who have spinal deformity. Now, this is an example of a traditional surgery done laterally versus a minimally invasive one, on the left versus the right. As you can tell, the incision size is very different. Therefore, the recovery is also very different, as the surgical footprint is much smaller with minimally invasive than traditional. Robotic spine surgery. Robotic spine surgery is the next evolution of minimally invasive surgery. These are the advances that have been made over the last 4 decades. Here at Advent, we have an Excelsius robot, which allows us to do spine surgery more efficiently and now more accurately in a minimally invasive way. But with all that said, traditional surgery is not all bad. There are some positives, and traditional techniques are still very important in the practice of any type of surgery. When is minimally invasive surgery better when you compare to traditional surgery? Minimally invasive surgery historically has not been used to correct deformity. That has been more the traditional surgery. MIS surgery is used for 1 or 2 level disease. It's great to address sciatic pain or radiculopathy, and it's a very good technique for spinal stenosis. Elderly patients tend to benefit more from minimally invasive surgery. Traditional surgery was used for severe scoliosis or deformity, multi-level disease, more than 3 or 4 levels, and patient selection is very important for traditional surgery. But the most important part of MIS surgery is the surgeon experience. The experience of the surgeon regarding the training of minimally invasive surgery provides the biggest difference in outcome between MIS and traditional approaches.